Hello and good morning. This is Dr. Gaurav Sharma here again, sharing the good case of the day. This is a patient who presented with a swelling in the distal forearm region since last 10 days or so, and is actually sent to rule out soft tissue mass. So, this is a PDFS axial MRI sequence, and we are scrolling from cranial to caudal as we are going down. So, we can see this is the second extensor compartment tendons, and this is the first extensor compartment tendons. So somewhere in the proximal forearm, they cross over. So the first extensor compartment tendons right now are more medial, and then they go superficial to the second extensor compartment tendons right here. They cross over, and then they become more lateral and become the first extensor compartment tendons uh, right here by the radius. So this point of crossing over, you can appreciate that this point of crossing over or intersection, there's a significant amount of soft tissue edema and effusion at the point of crossing over. What is this called? This entity is known as, let's look at the coronal image, the corresponding coronal image. So we can see this is the first extensor compartment tendons going, which were medial. Now they are crossing over, and we can appreciate there is this significant amount of edema and fluid around this first extensor compartment crossing over tendons. Now as they are crossing over, see this significant amount of fluid, and then the first extensor tendons continue in the wrist. So this is a classical case of proximal forearm intersection syndrome. So this usually happen in people who do a lot of pronation, supination, flexion, extension movements at the wrist, which sometimes in India it is commonly housewives who wash a lot of clothes and who prepare a lot of dough. So proximal forearm intersection syndrome is an entity we should be looking at when we find swelling in the proximal forearm region.